legislation and regulation. What are your beliefs regarding the emergency medical services system here in Barbados and patient care?
As relates to legislation,
Yes.
I believe that it is still in its embryonic stages. We do have a well organized public emergency medical system, but there are private practitioners who do contribute towards significant responses for patients within our community, and because we have a national health type system, it should be regulated a bit more stringently so that they're all doing the same thing. The Ministry of Health, although they have a paramedical council, cannot guarantee that the level of care is the same across the board and the protocols are adhered to the same across the board. We find that then the medical director of the public emergency medical systems responsibility to then ensure, and it is all goodwill, that the private emergency medical systems then cooperate, and I guess they cooperate within the constraints of their finances as well, in terms of how they blend in the medical care.
Do you believe that legislation and regulation are important to the success of pre-hospital EMS service delivery, patient care, and patient outcome?
Absolutely, but not only. I do think that it's a good framework to enforce, monitor, and drive standards, but obviously that's not the only thing that is required.
So how do you think they impact EMS service delivery? Can you provide me an example? How you think legislation and regulation impact pre-hospital?
Yeah, so if it is that, we have to have a 24-hour service, that should be legislated, that the service is provided 24 hours a day. If it is that, and it is, if it is that we're in hurricane season and we're considered essential services, when we have a national shutdown, we might have something this week, that should be legislated, where we're expected that at some point, whatever the disaster plan is as it relates to the responses of the pre-hospital personnel for patient care, that should be legislated. So that's a national and public health issue. Try to find some other examples. If it is that, in terms of the regulations now, if it is that we want the paramedics to provide advanced airway techniques, that should be regulated. Because as it is now, they're not obligated to do it. Yes, it is with advancement of patient care, but it should be some sort of regulation, not only at the clinical directorate level, but for medical legal coverage as well. That they should be covered, that's the term they like to use, for doing things that were not initially perceived as their scope. Their job descriptions may have been structured so that they are only allowed to do certain things, but now it should be coordinated that they can do more advanced procedures.
Okay. What are some things you think that influence how A&E doctors and A&E nurses or even pre-hospital providers feel about EMS?
We're from a small community, so it's our belief structures and how we were brought up. Some of us are religious based, and the communication and interactions that we may have on a day-to-day basis. So it's all socialization, I would say. We work well together because the structure is already established, where we recognize that we do most of our training on an integrated method. So most of our resuscitation training, we have EMS as instructors, or mass casualty training or EMS or some instructors. So most of the training that the physicians as their junior or the nurses have to do, they already interact outside of the work setting where they're bringing more patients as it may be perceived. They already have an interaction, so there's a level of respect there, and camaraderie and teamwork and so on already. It's one of the things that we will try to do to improve relations. Some of the beliefs that we may find negative, maybe because of the workload imbalance and the environment of care that they constantly get. In terms of, give you some history. So the ambulance service has moved from one location to another due to environmental issues, but every time they move, they get good quarters. They get rest areas, male, female, a nice kitchen, and so on. The A&E department has been asking for such staff quarters for 15 years, and we're still in very cramped. We're now probably going to get it, with this new government. Still very cramped quarters. So there's a jealousy there, because it seems as though the pre-hospital personnel are taken care of, but the emergency services are not. So all of the socialization causes for camaraderie some days, conflict some days.
So when we talk about feelings, would you characterize your feelings about issues involving legislation and regulation as being negative, indifferent, or positive?
Feelings as it relates to issues involving legislation. I guess it depends on the. Generally, I would say it's indifferent. But it depends on the particular area of concern. So, coming on to hurricane season, we're expecting something in the Atlantic. If on the occasion that we have had national shutdowns in the past, then the ambulance service are quite comfortable with their roles and responsibilities, but then there's a conflict with the emergency personnel, because we are expecting that persons, rightly or wrongly, you may still go and collect a baby that's about to be delivered, but you can't, because the government said that you're on shutdown list just like everybody else. So there's usually some sort of conflict on specific occasions, but generally we just go with the flow.
So thinking still along the lines of legislation and regulation and how it's influencing you or your peers, how does it positively influence your behavior as a A&E doctor, or any of your peers, or even the pre-hospital providers? How do you think legislation positively influences?
Well, we as a culture are quite compliant and complicit, so if it is what it is, you just accept it.
Okay. How do you think it negatively could influence your peers or yourself?
If we find that we want to progress and the progression is hindering, the structure is hindering any progression that we may want to make, that could be considered as a hindrance or area of impacting negatively. You want an example? I'm trying to find one.
You know.
I'm thinking, trying to find one. Don't want to use the disaster response again, because we're working on that.
Yeah, like a situation that you think that a particular time in legislation and regulation negatively influenced you as an A&E physician, or your peers, or a nurse.
Regulation. Okay, well, find a stroke patient. You gave me a good example, which when we first started the stroke protocol in 2014, we wanted to use the same example that you brought, where we wanted the ambulance service persons to send the patient straight to CT, but they're supposed to come and deliver the room to hand over, so that was an issue. Then other examples of patients being transported, not other than the emergency department. All patients that are taken from the community have to go to the Yaxley Emergency Department, even though they may have low priority complaints.
And that's because of legislation.
Yes, and the polyclinics are right there, and we're wondering, why can't you just send the patient to the nearby polyclinic? And that is a problem.
Now let's move on with some questions about medical direction. It refers to each Caribbean country having a qualified EMS medical director who oversees the country's EMS system and provides guidance for all EMS providers. It refers sometimes to the appointment of an EMS medical director for each Caribbean country as well. It often requires involvement in clinical care, EMS system design, scope of practice, credentialing, population-based care, occupational health of the EMS providers, and encouraging and initiating research. Tell me about your beliefs regarding medical direction for pre-hospital EMS providers within Barbados.
Well, I think that the EMS needs to work quite closely with the hospital services, because as one advances, it will impact on the other, and vice versa. And the medical direction is, I would say, it's a requirement, so that we can maintain standards and have consistent levels of care.
Okay. What are your feelings regarding the medical direction of pre-hospital ambulance workers in Barbados? Your feelings about issues involving medical direction for the pre-hospital providers?
I feel it works very well so far. I don't have any strong views for or against it. I think it's becoming a well-oiled machine over time. I guess because most of the physicians are at the same age and stage in our careers, so we tend to work well together. And having grown up with most of the ambulance service personnel in our career too, and most of the times we bond over mass casualties, which is a terrible thing to bond over. But as we are maturing, I think we're working well together. So.
Would you characterize your feelings as being negative, indifferent, or positive? Positive. And you feel this way because you mentioned the mass casualties and the fact that you grew up together and things of that sort. Okay. Describe your thoughts about the things that influence the behaviors of A&E doctors or nurses, or even ambulance workers, as it relates to medical direction. What are the things that influence their behaviors based on medical direction?
The medical direction, well, respect. If you don't respect the person giving the direction, you're not going to really want to comply if you have a difference of opinion. The fact that we all try to communicate constantly as it relates to the reasons why we're changing what we're doing. So the stroke one was the last big thing that we changed, the acute stroke services. And I do think that generally we get the buy-in from most persons, but because of lack of resources and the conditions of work, overworked, underpaid, everyone's getting frustrated and burnt out over time, you find that you go back into your archaic ways of treating patients. So things are not always consistent. It is a continuous work in progress, but it is a frustrating work in progress.
So why do you think those things influence behavior?
Because it's human nature. You don't want to feel as though you're butting your head against the wall. So you have all these ideas and you're keen and enthusiastic, and then you get to a point of frustration when things aren't being consistently carried out, and then some people just give up. It's part of being burnt out, I guess.
So, still along the lines of medical direction provided to pre-hospital providers, how is it influencing your actual behavior as a E&E physician?
It hasn't really changed my behavior as an A&E physician in terms of the medical direction. I still participate in academic emergency medicine, so we try to improve continuously. We have metrics and objectives that we have to achieve, report on for the in terms of governance and performance. So, as an administrator myself, there's still targets we have to make, and we try to review and assess and communicate and try to make sure that persons, have all well-beings, in terms of you try to pay attention to everyone's concerns, and you still try to meet the goals, although you may get setbacks because of lack of resources. You want to get medical direction so that persons can do advanced airway or even IV access and giving glucose or ECGs and telemetry on the ambulance service, and those things you get done, but then you can't sustain them because you run out of ECG paper, or a machine gets destroyed, or the ambulance gets broken down. So those are frustrations that you know what you want to do at the end of the day, but you can't sustain it because of things beyond your control, and you try not to just give up and say, all right, fine, you won't bother. You need to just regroup and continue trying to.
So those things you talk about, they seem to negatively influence behaviors potentially. Is that right?
Well, no.
No?
I don't think those things negatively influence behaviors, but those things we recognize are the reasons for our frustrations.
Understood.
And we still try to move ahead to meet our goals and our targets.
In a positive way.
Yes.
Understood. So they potentially positively influence behaviors as well. That's what I'm asking you. Do you think or if you can give me an idea?
We're still trying to push past the challenges.
You're still trying to push past the challenges. Okay. Are you able to tell me a particular time when medical direction negatively influenced the behaviors of your peers or even yourself as it relates to the EMS service system?
Yeah, so for mass casualties, because we're the only hospital, the medical direction, we would dictate when we want the patients brought to us. And several times, I guess because of the environment and you're out in the field and you have a lot of onlookers and the crowd can't be controlled as well as you would like, the thinking is just bring everybody to A&E. And if you went through A&E, yes, the A&E's overcrowded, you have somebody that is stable, our medical direction would be hold that patient until we can receive the patient appropriately. And that can sometimes cause a conflict. Especially if you have VIPs in the field. So sometimes even though the pre-hospital personnel may appreciate our concerns, there are other influences which may be political or environmental that may provide a conflict.
In closing, how long have you been in the profession?
I've been a qualified emergency physician for 16 years. 16 years.
How do you like what you do?
Most days, I love it. Some days, I question myself.
Wonder why. Well, we've covered everything I plan to cover. Do you have anything else you'd like to add that I haven't asked? No? Okay. Well, thank you so much for participating. I appreciate it.
Too long?
No. We're at 20 minutes.
Good.